Guys, stay quiet for a second. He's coming down the corridor. Any change since you called through?
So this is Bradley. He's been driving a semi-trailer along a 100-kilometre-an-hour road, swerve, and then down a ditch. He says he blacked out.
Why did he pass out? That's the unanswered question.
Wasn't an intentional thing, was it?
Raw mobile receiving, go ahead.
Just got a major trauma which want to bring in. Bill at work today when a approximately 500-kilo truck axle was landed on his right elbow.
Thanks, Point Cook. We'll see you in 20 minutes. Raw mobile out.
Paramedics are rushing in 29-year-old Billy, a heavy diesel mechanic.
It's got to be trouble. Anything industrial, it's always trouble.
Hi, how you going? This is a gentleman who's had his arm squashed. We'll get to it. Pretty sore.
It's more just I need to straighten my arm out.
Yeah, and you can't?
Yeah.
It is still bleeding because he keeps doing that.
I apologise for the dirty sheets.
All right, we're going to make you do the washing.
We'll do the handover if you're ready.
Yep. This is Bill. Bill was working underneath the truck, looking at an axle, and it has fallen, landing directly on his right elbow, approximately 500 kilos. They've craned it off him straight away. One of his workers said he did see some spurting. Paramedics arrived on scene.
No arterial bleeding. Yeah.
Just got some numbness tingling in the fingers.
Okay,
Other than that, good movement. Got a peel
normal
pulse.
neurology. Yep. Thank you.
Feel better,
Yes.
Bill?
Thank you, lady.
So the axle landed on this bit or this bit?
Like right in the crevice
Right,
of the elbow.
right in the crevice of the elbow. Yeah, yeah.
So it's a
And-
flat plate, but it's got two bolts on the front and back.
Okay, yeah.
And the bolt was what?
Did the bolt dig in?
Yeah.
Yeah.
Can you feel me touching you here?
Yeah. I
Yeah.
can feel you
Can you feel
touching
this?
me. Yeah.
You go like this for me. And hold it nice as you can. Good. And like this. Strong as you can.
It was definitely a bit of a pancake, but
Yeah, and you've got a big cut.
Just-
Well, why don't we give you a shot of something and then we'll unwrap it, we'll give him some fentanyl, and then we can have a look at his arm. What I'm worried about is anytime you get that much force going through a limb, you can break a bone and you can cut a nerve or bruise a nerve, because if the nerves are damaged, it's much more serious.
Peeling back the bandage reveals an alarming wound.
The dressing comes down, there's a lot of blood.
Yeah, you've done some damage there. You put pressure on it, I'll get it. So it looks like he's hit some venous structures in the crural fossa, doesn't it?
There's quite a lot of bleeding. If you hit an artery, then usually the blood spurts across the room. It's not doing that. It's bleeding like a vein bleed.
Can you move it? Is that...
I can move it. It's just tender.
Yeah.
Yeah.
All right. And what about that?
Tender again, yeah.
So it's probably going to be broken. Yeah. Have a look.
If you're able to put your arm down for us. Sorry, like
So that's the two things that dug in, yeah?
Yeah.
You just got to rip it open.
Yeah.
Yeah. So we're going to get a photo mainly so that the plastic surgeons can have a look.
And we can transmit that straight to the surgeons who are in the operating theatre, so they know what we're dealing with. It's trouble.
How much is it going to matter though?
Well, not much, actually.
That'll be all right.
No, it'll be all right.
Can I get a photo?
Well, we'll get you the photo. Souvenir, yeah.
Yeah.
Happy with photos? Yeah.
With such a deep wound, the risk of infection is extremely high.
What about tetanus? Do you know when you last had a tetanus injection?
Probably when I left the army.
Yeah.
2018.
Oh, okay. So you'll be covered. Yeah. What did you do in the army?
I was a plant mechanic.
What, sorry?
A plant mechanic? Like a
Oh, okay.
digger.
Yeah. So you saw, like, action or something in the...
Oh, I've done enough.
Done enough, yeah.
He's an army guy, so he's probably seen some stuff. And I guess when injuries happen, you just have to get on with things.
So I can feel pulses, right? Do you still have numbness or tingling in your hand, or do you not have that?
Tingling in the fingers? but
Tingling in the
everything else
fingers.
is-
So I guess with that, it might need to be explored.
So if we can feel the pulse downstream, there's blood flow going down there. If you lose the blood supply to your arm, you could lose your arm.
Where's he going?
He's going to trauma 1.
Thank you.
The emergency team is on high alert.
Are you team leading?
Air ambulance has arrived from country Victoria with a critically injured council worker.
Thanks for coming down.
Emergency Dr. Michael Dunn gathers a large trauma team.
Okay, well, I'll do the fast if you like.
Yep.
And
Even calling in the experienced hands of the Director of the Emergency Department, Dr. Mark Putland.
In the badly injured patient, there's a few immediate life threats that we can make a difference to really in the first few minutes of care. But that requires a huge team of people to descend on the patient and to all act together.
Okay, team. Guys, stay quiet for a second. He's coming down the corridor. I'm very worried the noise will be loud here, so I don't want you talking unless it's absolutely necessary, okay? Trauma, or you're going to do our primary, you're going to do our fast scan. Gavin's taking the airway, and then we'll get X-rays and check vital signs, okay? But I want silence during the handover if possible, so we all hear the story of what's going on. Hi, guys. Any change since you called through?
No. He's been persistently tachycardic, but his blood pressure's always at 150.
Okay, so stable. You're happy to transfer?
Yeah.
Then do handover? Yeah. Okay. Okay.
The patient is 42-year-old Bradley, a husband and father of 5 young children.
Might just get a dedicated person to the leg as well on the transfer over.
Without warning, his truck careered off the road and slammed into trees.
The really big immediate life threats are loss of airway, injuries inside the chest causing leakage of air or blood from the lung that eventually can crush the lungs and crush the heart.
Okay. You happy doing the handover?
Yes, absolutely.
Yeah.
So this is Bradley. He's been driving, restrained driver of a semi-trailer, driving along a 100-kilometre-an-hour road. Other motorists have seen him swerve, and then he's gone through a barricade, down through a ditch, and into a whole bunch of trees. He says he blacked out, can't remember any of the incident, and it looks like he's got a right femur fracture.
Okay, thank you.
One of the commonest things that causes someone to black out is a arrhythmia of the heart, where the heart stops beating as it normally should do.
So you had a good view?
We're looking for signs and hints of something more serious.
Take a deep breath for me.
Bleeding into the chest is Dr. Mark's immediate concern.
There's a rib.
The tummy and heart.
Yeah, that's good. That's negative.
Through
Good.
the lung.
It's hard. Push over. Yeah, good. Other side. Yeah, good. There's lung slide. Good. Done. E-fast negative? Yes, E-fast is negative. Excellent. So let's get bloods, including police blood. On top of the trauma bloods, let's get a troponin as well.
My biggest concern with Bradley is why did he pass out in the first place? There's something wrong with his brain or heart that's causing this, and that's the unknown.
Now, I just want to quickly ask you, do you remember moments before you crashed? Do you remember in any way feeling unwell?
Yeah, well, this morning I thought, mate, like I had a bit of a cold.
Yeah. And when you were driving, did you feel dizzy or did you feel
No,
unwell?
I just blacked out.
So you felt perfectly fine?
Yeah.
And then suddenly, next thing you remember, you're...
In someone talking to me.
Okay. But you weren't confused for a long period of time, no? Okay. Let's get some portable x-rays and then we'll log roll and then we can go to CT afterwards.
Hold your breath for me.
X-ray. I think we factor in the time to get here into how sick he is. I mean, the fact he's been 2 hours stuck in that truck, there may be injuries that haven't been treated for some time. So we just have to be a little careful and take our time.
So he's got a fracture through the middle here of the thigh bone, the femur, and also a chip here. Yeah, it's a pretty bad break. Anything that involves your weight-bearing bones is going to be serious and likely need an operation.
We're going to roll you to one side.
The team need to check Bradley for spinal injuries.
I'm going to poke down your back, and I want you to tell me if it hurts. Then we're going to check the sensation just near your butt cheeks as well.
Okay, team, we're going to roll on 3. 1, 2, 3.
Okay, that's good. Pain here where I'm pressing.
Yes, fucking lots.
Here where I'm pressing. Yep. Here.
Yep.
Here.
Yep.
Here.
Yes. Oh, hang on, no, sorry.
Okay, where
That's
I'm
your
pressing.
leg that's sore.
I know. On the back where we're pressing, is the back sore?
No.
Posterior thighs, okay.
Sorry, I was getting confused.
No, you've done well. Okay, we're going to roll back on 3. 1, 2, 3. Stay still for me, mate, here. Stay still. How's your pain right now out of 10?
Your leg's freaking sore.
Do you want some painkillers?
Yes, please.
Yeah. We're going to put some local anesthetic into around the groin area
Right.
to numb up that right leg for you, okay? You've broken the thigh bone midway through. That one needs to be fixed. I'll put a rod through that to fix that, okay? but this will keep you numb for about 12 hours, so you're not in pain. All right?
Let's just get in here, make the man comfy. G'day, my name's Mark, one of the many doctors. All right, thank you.
Just me, or is there a lot of Irish doctors?
Oh, Irish, English, all sorts here.
Yeah.
Hi, it's Michael here in Trauma 1. How are you guys going from a CT perspective for our trauma guy? 5 minutes, short. Cool, thanks. 5 minutes. How are you feeling? You okay?
Yeah, not bad, mate.
We're gonna get you around for a CT scan. Obviously, we've got the leg injury, and we've got the wrist injury. That will both have to be looked at. But the other thing we're gonna be doing while you're here is working out what happened that caused you to pass out and crash.
Yeah.
That's gonna be part of your workup as well.
Yeah.
I know it's probably, you said you don't remember anything. Wasn't an intentional thing, was it?
Absolutely not. No.
Good. Have to ask.
It can sometimes be a bit confronting asking someone in a car crash whether it was intentional or not. And that's something that you'd often think about, but we do see it from time to time as a form of a suicide attempt. And I think it's important that we don't ignore the uncomfortable questions because they're uncomfortable, and that we're treating whatever condition needs treating, be it physical or mental.
Do you have any family that know you're here or want to know that you're here?
That's probably here.
What's her name?
Somewhere, Christy.
Christy.
What was it, 16 year wedding anniversary last week. So yeah, married me childhood sweetheart. We'd been together since I was 16, so.
100% the worst call I've had. We have a very busy household. We have 5 children, so, you know, how quickly that could have been taken away from us.
Bradley's work future is uncertain.
You know, Bradley's a driver by trade, but I need to figure out why he's collapsed in the first place, and is that going to happen again? And if he has something like a seizure, or if he's had a funny rhythm of the heart, that might prevent him from working again.
And then we'll need to do some tests to figure out why you passed out in the first place. Because that happened, unless we have a very clear-cut cause, you probably won't be able to drive for a while.
Yeah.
It's dug into the tissues.
29-year-old heavy diesel mechanic Billy has a horrific injury. A semi-trailer axle weighing 500 kilos fell on his arm.
Don't think it's hit the artery. The bone might be involved. The bone's involved in an operation, but it's just going to depend on the X-ray. Do you still have numbness or tingling in your hand, or do you not have that?
Tingling in the fingers?
Tingling in the
everything else
fingers.
is fine.
Right. The tingling in the fingers means he's got nerve damage. So if the nerves are injured at the elbow, you can certainly lose the function of your hands. Then he might not be able to work again. He's a mechanic. He needs to use his hands. Let's just do the plain X-ray and see what it looks like. We might need a CT of the elbow, depending on what the X-ray looks like.
You mind if I try and make a quick phone?
No, by all means.
Trying to call my partner just to... I don't want work to call her before I get through to her. I'm all right, I'm good, but I'm in hospital. All good.
I just got a call from Billy and he said he had a little work accident. I don't quite know what to think, but you don't really get taken to A&E for no reason. I'm just very confused because talking to him, he sounded fine, but I know he's a very strong person who likes to downplay things sometimes, so I'm trying not to freak out.
X-rays will help determine the extent of his injury.
So, cunningly hidden underneath the bit of surgical dressing, there looks like a little problem here. Maybe a little crack in the medial epicondyle, which would make sense. The way he can't extend his arm suggests that there should be a fracture, because he can't extend. Whenever he extends, it hurts. We're going to get a CT. That'll sort this out.
While Dr. Jonathan organises the scan, emergency nurse Tabitha checks on Billy.
Can you lift this arm up for me? Let's see where it's bleeding. It's bleeding under there.
And raises the alarm.
Oh, lots of blood.
Yeah, we're going to open it.
Has it just started bleeding?
No, it's just been slowly...
Oh, it's been slowly oozing, has it?
Yeah.
I'm Emma. What's your first name?
Billy.
Billy.
A 500-kilo axle collapsed on Billy's arm while he was working on a semi-trailer.
Okay. And then you haven't had a CT scan or anything?
Emergency doctor Emma West has been called to urgently help.
You can feel me touching across your hand. Good return.
I can see that he's bleeding through the bandage around the front of his elbow, and that's where the brachial artery sits. It is a major artery that then supplies all the muscles, the bones, the nerves from the elbow down in the forearm. And it's absolutely vital to the function of your hand. It can bleed high volumes, and that can threaten Bill's life.
Dr. Emma raises the alarm with Dr. Jonathan.
He's got a big wound and it's bleeding. He's got what?
Detached.
Oh, has he? Well, he's bleeding through that. Okay.
You're bleeding underneath.
Yeah. You're going to take it off and then reinforce underneath?
Yeah. There's a lot of blood. This looks like a lot more bleeding than there was before. So has the artery started to bleed?
What, is that your shoulder hurting or your arm?
So was there an arterial injury that was kind of spasm and now it's just popped open and started to bleed? Is that what's happened? Maybe things are worse than what we thought.
There's nothing pulsing out, but you can see the pulse of the brachial artery.
It's called gravity.
Can you see that?
Gravity's our friend. Yeah.
There's the brachial artery pulsing away. It's there for us to see.
Yeah, just actually.
Oh, that's really sore, isn't it?
Oh, yeah.
I'm going to do a really tight one just over the first top. Sorry for that. That feel tighter?
Can you bend your elbow just a little bit? Yeah, that's great.
Can you just make sure there's a nice little pulse there? You can see his brachial artery pulsing in there.
I know. You can see how the puncture marks went either side of it? Not
Yeah.
right here, just...
How does your hand feel? Does it feel any different? No.
Bend the two fingers.
Yeah.
That's it.
Work it out. You definitely have a fracture there, though. Let me just double check your pulse. We've felt his pulse a few times, and the pulse down at his wrist is not as good as it should be. But if he's damaged an artery and he loses blood supply, he could actually lose his hand through lack of blood supply. So we're going to do a CT angiogram, which will give us a picture of the artery. Can't get to CT fast enough.
Obviously, we've got the leg injury and we've got the wrist injury that will both have to be looked at.
Dad of 5 Bradley has a badly broken leg after his truck careered off the road and into a tree.
So look, we'll get you around, we'll get the scans, and then we'll need to do some tests to figure out why you passed out in the first place.
I just can't believe I'm here and I can't believe it happened. I was a bit sort of off colour. But yeah, next thing, I'm bloody shitload of trees with no roof on the truck.
Now, we're going to bring you around to our CT scanner, okay? They're going to give you some contrast, which is basically dye that they inject in the veins to see the blood vessels. It gives you a really warm, flushed feeling and makes you feel like you've just weed yourself, okay?
Rather than actually leave.
A scan of his brain may solve the mystery of why he lost consciousness.
So we're in since hospital.
You're in Royal Melbourne Hospital. It's top of the CBD in Melbourne.
We're not only looking for traumatic injuries from the crash, but we're looking for causes of him to collapse in the first place as well. What I really don't want to see for Bradley is injury to the blood vessel leaving the heart, and in particular, no bleeding in the brain.
Oh, hey, it's Michael here in emergency. We have a trauma patient he's absolutely no recall of the event, and we're concerned about his seizure. His brain scan looks fine to us.
While the brain scan is clear, Dr. Michael still needs to find out why Bradley blacked out.
It's more, I don't want it to be postponed and then so far from the event that it's not accurate. And given the impact it's going to have on him, but I'd like it done. If a seizure is considered to be a possibility as to why he actually crashed the truck, it can have pretty profound impact on his life. Like someone who drives a truck, for example, you can be years without being let behind the wheel.
Who's your next of kin?
Christy, she's a hairdresser, but she was at work today, so someone would have like half a haircut, I'm sure.
Christy, Bradley's wife, can finally hold her husband.
Hi, how are you? I'm Michael, I'm one of the emergency doctors looking after Bradley. You okay?
Yeah, no.
Yeah. The other thing we need to figure out is why he passed out in the first place, and that's going to be a separate line of investigations, looking for things like seizures or funny rhythms of the heart and those sort of things. But I suspect that'll be the plan. All right, but look, I'll keep back and keep you updated, all right?
Bradley's got a bit of a course ahead of him. He's got to recover from his leg injury. But on top of that, it won't just be about physical rehab. We're going to be trying to figure out what caused him to crash in the first place. He can go home safe knowing that it's not going to happen again.
Oh, right. Okay, you got your
Nothing
present.
to see here.
That's your pay for today.
Cobram peaches.
So you could just go home and get them.
It's a long way. It's a 3.5 hour drive.
Don't you go there every second weekend?
If you show me respect today, I'll leave one on your desk for you.
You'll leave one on my desk for me.
Leave one on my desk.
Just leave it on the desk and I'll assume it's for me. Outrageous. The shared desk.
Just across to the other bed now, Colin, okay? On go, ready, set, go.
In Trauma Bay 2 is a 71-year-old bike rider who's been involved in a serious collision with a car.
We're just gonna give some oxygen as well, all right? Yeah. Okay.
So this is Colin. He's been riding his bike today when he's been hit by a car. He's got a compound fracture to his left ankle. He's got some slight reduced sensation and some numbness to his left foot.
Taking the lead is emergency doctor Luke Delarue.
Hello.
Hello.
How you doing?
All right.
I'm Luke. I'm one of the emergency doctors.
Good. G'day, Luke.
You've done a good job of your ankle, by the looks of it.
Car did a good job of it, yeah.
Yeah. Do you have any pain anywhere else?
No.
How fast are you going?
I don't know, 15, 20 kilometres an hour.
I'm not a bike rider. I've worked in a trauma centre for too long to ride a bike, particularly in the city.
Do you think your leg went underneath the car, or you landed awkwardly on it, or it's hard to say?
It's hard to say. I think I didn't go under the car at all.
Yeah, okay.
In any way.
Yeah.
Paramedics have identified that Colin has what looks to be an isolated injury to his ankle, and they've described that as a fracture dislocation, which means there's significant damage there.
So you cycle a lot?
Yep, try to, yep.
Each day, or?
Not each day, but yeah, two or three times a week, yeah.
Still more than me. And does your wife know you're here?
I don't actually know that I'm in this hospital.
Okay, I will give her a call in a minute, okay? Did you lose consciousness, or you remember?
No, I didn't lose consciousness. I looked down and I thought the whole foot had come away.
Yeah.
Colin's concerns that he's lost his foot are very real. His ankle doesn't look like the shape that an ankle should look, and so we know there's significant injury underneath there.
We'll have a look now. Can you wiggle this toe?
Yeah.
Good. You can feel this?
Yeah.
And this?
Yeah.
What about up here?
Yeah.
The main issue in fracture is that we worry that there's compromise to the blood supply and to the nerves to the foot.
I'm just testing the blood supply.
Just having a feel of your pulse there, Colin.
Feel it?
We need to identify whether a pulse in the foot is present.
No.
Because if there's not, that's a limb-threatening emergency.
29-year-old mechanic Billy is about to have a CT scan after a 500-kilogram semi-trailer axle collapsed onto his elbow.
So has he actually got an injury to the artery there? The angiogram will tell us. The worst case scenario is you do injure the artery and the nerve, and then the blood supply to the hand is no good and your hand doesn't work properly. What we're hoping not to see is damage to the brachial artery.
Billy's partner Hillary has made it to his bedside.
You okay? Oh my God, you're leaking.
This wasn't part of their plan when they came to Australia to build a new life.
We've been together for, I think, almost 2 years now. It's the first time I got a call like this. It is a little bit scary, yeah.
Billy will be having surgery. How complicated will depend on the final CT results.
Ooh. Yes, there was an artery injury. Here's the artery. There. The artery's not supposed to stop there. The artery's supposed to connect. The brachial artery has been transected, i.e. cut in half. And there's a gap of 6 centimetres missing from the artery.
So he's going to have a more extensive operation where they need to repair the blood vessel and repair the bone and repair the tissues over the top. Pretty extensive surgery.
As he heads to the operating theatre, Billy and Hilary face an uncertain future.
If we couldn't repair the nerves or things were irreparably damaged, then he might not be able to work again.
I'm just testing the blood supply.
71-year-old bike rider Colin has a badly broken ankle after a serious collision with a car.
Feel it? I don't think we ever feel it's real.
To have a chance of saving Colin's foot, they need to find a pulse.
Oh no, I got a pulse.
Let's get an X-ray.
With a pulse confirmed, there's hope his foot can be saved.
Are you able to angle one down and just like this? It'll just helpful, just something that'll give us more information.
X-ray.
Let's get a couple more pictures of that foot, okay?
X-ray.
They'll soon be able to see just how bad the fracture is.
Yes, that's exactly what I want. Yeah, thanks. So he's displaced sideways, but he's also, this dome should sit underneath here. So he's not just fractured there, he's dislocated there, and he's knocked this part off. So he's blown both sides out, which is why he's dislocated. Yeah, so it's an open fracture dislocation, so the risk of infection is very high. When the bone is actually protruding outside of the body, bacteria getting into the wound can be really problematic. It needs to be rapidly cleaned, rapidly reduced, and then splintered. So it is broken and is dislocated as well.
Oh, okay.
So the concern is it's an open fracture dislocation.
Right.
The priority right now is to get it as straight as possible.
Yeah.
To restore the blood flow to the foot.
All right.
All right? If we don't do that in time, complications of that can be really significant, up to and including amputation of the foot itself. So we're going to take it down, have a look, give it a wash, pull it straight, put a temporary cast on.
Yeah.
And then you'll probably need an operation at some point to fix it.
Okay.
Okay?
Yeah.
Medication I'm going to use gives you kind of vivid, funny dreams.
Yeah.
So you get to choose your own adventure, have a think about something nice. So this is a really painful injury. So the best thing for Colin in this case is to perform procedural sedation. So that's giving him essentially like a light anaesthesia so that he's not aware of the pain and so that he's not aware of the procedure that we're about to do to realign the joint.
Nice, yeah. All right.
The happier the thoughts, the happier the experience will be.
Yeah, sure.
Okay? Yeah, we'll be here the whole time with you.
Okay.
I'm going to give him a little bit of ketamine now as analgesia just to see how he responds. Yeah. There's a number of things that can go wrong. We always worry about maintaining the patient's oxygen levels, maintaining the patient's blood pressure. That's another 50. And there's always that risk with too much medication that the patient can stop breathing completely. And so we need to be very close by in a very controlled environment to manage these risks. It's just a little bit of that medication as a taster, all right? So you might feel a bit warm and funny. You okay?
Starting to get there.
You can close your eyes, think happy thoughts.
Yeah.
Almost ready, I reckon.
Orthopaedic surgeon Dr. Shun can now begin the job of saving Colin's foot.
Over here.
As the bandage is unwrapped, they finally see just how horrific the injury is.
Wow, that's impressive.
It's a really serious injury. The foot actually looks like it's partly detached from his leg.
Just a few hours ago, passionate cyclist, 71-year-old Colin, was enjoying one of his weekly rides. Now, doctors are trying to save his foot.
I can see a really significant laceration extending into the ankle joint, and I can actually see the lower part of the tibia protruding out through the wound.
Pulling the bones back into place would be excruciating, so Colin needs to stay sedated.
Look straight here.
This is a crucial moment as Dr. Shun attempts to push the bone back in and realign the foot.
Open your eyes. Doing well. You okay, Colin? Doing well. Does it feel a bit more stable than anticipated?
Clumped back in. It's going to be unstable, but we'll see.
How you feeling, Colin? You okay?
Yeah.
You're doing really well. You're in hospital, you're just waking up, okay? Just done a little procedure on your ankle, okay? But it looks nice and straight. Looks like the way an ankle should look, which is good.
Is my wife here?
I'll go find her in a second, okay?
Colin's wife Linda and son Tim can finally see their loved one.
I didn't knock anyone over, dear. When I looked down, it looked like my whole foot was attached to the bottom of my leg. No, when they did the foot, I thought I was in a Stanley Kubrick movie.
No, you were out of it.
I sure was.
Even though the alignment is back to normal, there's really none of those pre-existing structures that hold the ankle in place. So he's still got 2 broken bones. He's still ripped through all of the ligaments that hold the ankle together. It really is like a bag of marbles until the operation occurs.
I'm take you around for your scan. Okay.
And then the orthopedic surgeons will place some metal rods and screws to help fix the fracture and the ankle joint back in place. It'll be a really quite a long time until he's back doing the things that he was doing before.
Dr. Michael's next patient has arrived. 81-year-old Judith has been rushed into ED with an extremely high heart rate, almost collapsing after running errands.
How far away?
I thought that was similar times.
I'm happy to look after this. I'll give you a call if you need a hand.
Okay, I'll go see Judith now.
Hello. Hello. Hi, how are you? Michael, nice to meet you.
Are you a nurse or a doctor?
Doctor. So, what's happened today?
Everything.
Yeah.
Yeah, drama.
Yeah.
Just needed a bit of attention, I think.
Well, it worked.
I felt very second-hand all day.
In what way?
I was really shaky, really shaky, but no chest pain or anything.
So you felt ordinary today?
Yes.
Tired and shaky and not quite right?
Yes.
Sure.
I live alone, so...
You don't want to go home until you're well and safe?
No.
Exactly.
So I thought I'll get the Omron machine out and check blood pressure. When the pulse rate was 138 or something.
Yeah.
And it's mainly 77. And I did it again, and of course that set me probably into a bit of a panic.
I say so, yeah.
Judith's no stranger to hospitals. The retired pathology nurse not only has a troublesome heart, but has survived cancer.
How do you feel now? Much the same?
I feel a bit nauseated. You haven't given me anything yet for the nausea, have you?
I just charted some stuff. We're going to grab some stuff. Here we are. On cue.
Thank you, darling.
I don't want to ruin the shot.
I can't believe this. Where's Brad Pitt?
You've got your own Brad Pitt.
Yeah, it's not real
There you
bad.
go. Yeah. You're Irish, Brad Pitt.
Are you Irish?
I am.
Oh, gorgeous.
When she liked me to Brad Pitt, that was a bonus. Kudos, and she's going to get extra special care, of course.
Have you had this before?
What?
The shakiness and...
Never
No.
seen that pulse rate like that. I have got
Mm-hmm.
a top cardiologist, and he looks after my heart. I've been really frightened today.
When your heart's going that fast for that period of time, feels like something's terribly wrong.
Close monitoring confirms Judith's blood pressure and heart rate are way too high.
So it looks like from the ECG that the top part of your heart is fluttering. So normally it's meant to kind of beat regularly, keep the rhythm going.
Yes.
And instead of having a nice rhythm, you're having a bit of a techno party in your heart, and it's going really fast, and probably why you feel a bit tired and run down.
Right.
Because your heart's going so quick. So we'll do some tests to see why you're in it. Is there anything going on? And we'll go from there.
The worst case scenario for Judith right now is that her heart continues to go extremely fast. And because she has a degree of heart failure, it just can't keep up. The muscles gives way and really push her into heart failure. She's worried that she's going to die from this. I'm listening to Judith's heart in her lungs. I want to make sure she doesn't have a fluid gathering on her lungs, difficulty breathing.
But if you feel unwell at any stage later on, let us know. We'll get an x-ray and I'll come back to you, okay?
Thanks.
No worries, not at all.
Hello. Hello. My name's Ashley. I'm going to take you for an x-ray.
I want an x-ray to confirm that there isn't fluid in the lungs. And make sure the size of the heart's okay. It's not bigger than it should be. There isn't signs of decompensated heart failure is what we call it. It's when the heart failure gets dramatically worse.
I'm looking forward, Judith, to make sure there's no fluid in the lungs. You look to see any patchy kind of white stuff in the lungs, which we're not really seeing here. She's got a big old heart, so it looks pretty normal for her, I'd say, and normal to me.
Even though the x-ray of Judith's heart is clear, Dr. Michael needs to deal with the ongoing risks of her racing heart.
Now, whenever your heart's beating like this and not kind of in a coordinated fashion, you're a higher risk of developing blood clots as a result. So we're going to give you some blood thinning medication to try and reduce that risk.
Okay.
And the reason we do that is, firstly, as I said, to reduce your chance of clots. And it also means that if we do eventually have to do something about the heart, if it doesn't settle down with medications, we can give it a bit of a zap.
Okay.
To get it back into a normal rhythm.
If we don't get on top of this heart rate, she will go into heart failure and her heart will give in.
I went to see my specialist about the breast cancer, for a checkup.
Yeah.
That's in remission.
Yeah.
And he said, this won't take you out.
Yeah.
Your heart will.
Not this time. All right. No.
Not on your watch.
Not on my watch, no.
Okay. You're a charmer.
Okay, I'll take care of you tonight, Jude, all right?
And you're back in the morning.
No.
Righto.
No. I'm running away at about 1 in the morning.
Uh-huh.
But I'll leave you in capable hands.
All right. I'm
All
sure
right.
you will.
I will.
Lovely to meet you.
You too.
Gorgeous thing. Look at the eyes on that.
You're getting away with a lot today, aren't you?
I spoke with Judith's cardiologist, who knows her extremely well, knows her heart extremely well, and we keep Judith overnight for some observation, and in the morning time get her transferred to a hospital where he works.
I'll see you later on if you need me, okay? But I'll get you something to help you sleep tonight as well, okay? All right. Take care. No worries.
Have you just grabbed my things?
That's mine. That's mine? Hey, that's mine.
Take some pictures in my bag.
No, it's good for TV. I want to walk around with a picture of me, Emma. That's important.
There we go. Off I go home.
Spy out again. No, just...
Okay, team. He's coming down the corridor.
Husband and father of 5 Bradley was rushed to emergency with a serious leg injury after he crashed his truck into a tree.
Did you feel dizzy or did you feel...
No, I just blacked out.
Dr. Michael was worried he may have had a seizure.
I want you to do some tests to figure out why you passed out in the first place.
After 2 operations on his leg and a month in hospital,
Refreshment?
Thanks, Chris.
Bradley is recovering at home
Kids will be stoked.
No, they're hungry little buggers.
with his childhood sweetheart Christy and his young family.
I can fully weight bear now on that leg. The metalwork's all healing well and everything seems to be going okay. They still haven't worked out why I blacked out, so I've still got to see some specialists. I ain't my foot. Yeah, so I am back at work. In the office a bit at the moment, just generally trying to get back into the swing of things. Honestly, I'm glad I didn't die, obviously, but I'll just be glad that, when I can actually walk, it'll be nice to be able to do just simple things.
On go, ready, set, go.
Keen cyclist Colin was rushed to emergency after colliding with a car.
Did you lose consciousness or you remember?
I didn't lose consciousness. I looked at the ground and I thought the whole foot had come away.
Dr. Luke was worried Colin's foot would have to be amputated.
The foot actually looks like it's partly detached from his leg.
A day after surgery, Colin was able to go home.
They fixed that up and then they straightened the broken bone. It's all stainless steel plate and screws that I've got in the leg now to hold the broken bone together.
Despite the accident, Colin is back doing what he loves.
I've been able to get back on the bike since the accident. Short distances, of course. Cycling gives me a certain amount of freedom. It means I get out into the fresh air. It helps me to exercise. The care at the Royal Melbourne was fantastic. Yeah, I couldn't speak more highly about it.
81-year-old Judith almost collapsed running errands and was rushed into ED with a rapid heart rate.
I've been really frightened today.
Dr. Michael was worried Judith would go into heart failure.
The top part of your heart is fluttering. You're having a bit of a techno party in your heart and it's going really fast.
After being kept in overnight, Judith was sent for further care to a place where she's very at home.
I'm transferring from here to a hospital I worked at for 30 years. They're a good crew here. They looked after me and were very friendly. Beautiful. See you later. Thanks again. Bye, everybody. Bye.
29-year-old diesel mechanic Billy sustained a deep cut to his elbow when a 500-kilo axle from a semi-trailer fell on him.
Yeah, you've done some damage there.
A bolt ripped into the crevice of his elbow, causing a deep wound.
You just got to rip it open.
Dr. Jonathan feared Billy had a severed artery.
Brachial artery has been transected, i.e. cut in half.
Following extensive surgery to repair the artery, Billy spent 4 days in hospital and is now recovering at home.
Considering everything, I'm doing pretty well. We had to get a forklift to actually lift the axle off my arm. I'd be a little bit nervous about changing an axle again.
Billy's partner Hillary thinks his former work in the military helped him keep a cool head.
I brought you a drink.
Even when faced with excruciating pain.
He's one of the most wonderful people I've ever met, and I really, really admire him because the self-control, even in crisis, he doesn't freak out. It's a big relief for him to be able to be back on the tools at work because that is where his heart and soul is. So I'm so happy to see him back doing what he loves.
Tweedledum and Tweedledee. The care that I got at the Royal Melbourne Hospital was unreal. I was lucky with the team that I had around me to make sure that I'm still alive and I still have my arm. I can't thank them enough for what they've done.